Well, that day, Chrissy and I decided to take the kids on a hike up by Denny Creek, Keewooly Falls. It was about an hour and a half hike. And that's when we noticed this big patch of snow.
The snow has probably come off the hillside and started going down onto the rocks, and has caused this cave effect. And basically, it's a big opening, and it's really beautiful. And you know, it's August, and you think, gosh, there's still all this snow here.
Yeah, well, when I first got up there and saw that it was a cave, I decided I wanted to, go into the cave a little bit and check it out.
I've never seen one before. It's August. You don't expect the ice cave to be there.
There were other people around. There was a man from a youth group that had quite a few young kids with them, and they had just been in the cave. My thought was because it was so huge, it was so safe, whereas if it would have been thinner, I would have been more afraid.
They took pictures of us, and then we started walking back into the cave. It's kind of like a dim blue light. Like sunlight could get through the ice, but it was pretty dark, and there was a ton of water dripping off the top of the cave.
Just before we heard the ice cave collapse, Cypress, Alec's dog, ran out. I don't know why. Maybe it was like some people say the dog has sixth sense or something.
I need you to calm down so we can get in contact, right?
Hello, everybody. We begin tonight with breaking news.
Two teenagers have now been trapped for more than 3 hours.
The airlift left Snoqualmie Pass and brought both Alec and Alessandro here to Harborview Medical Center. Both boys had broken backs and other severe injuries.
I think when I heard that boom sound and I turned around and saw all that debris, I think my first reaction was a little bit disbelief. And I said to myself, well, and the boys have got to be there someplace. Maybe they're beyond. And so then I just started yelling. And when I didn't get any response, that was like you just felt like your whole inside of yourself just kind of sank.
Oh, I just remember opening my eyes, and it was dark, like water splashing over my face, and it was pretty hard to breathe.
My 2 feet were dug in the ice, trapped there. My left arm was pinned under a tree and everything. And so for a little bit of the time, I didn't know where Alec was.
I was like folded in half, and my left leg was stuck under my body, and my left foot was stuck like right here under my right under my chin.
All of a sudden, I felt something hit my head, and then I reached for it, and I felt that it was Alec's shoe. And so I knew that he was okay.
So he grabbed my foot, and then, I grabbed his hand.
He kept telling me to squeeze his hand, to stay awake and to not pass out or anything.
At one point, I asked him if he was excited to start school at Blanchette, just to get his mind off of the fact that we were under the ice.
And then, then the guides start coming up, the rescuers. I just remember the first visual for me is that it's up. You're climbing up. It's pretty strenuous, and I think I want to say a couple miles up. I might be off, maybe a mile and a half. But anyway, and they're literally running up there. And so and it's cold at this point because now it's actually started to drizzle.
And we really didn't have a great idea of a location for the victims, other than we knew they were in a confined space. They hadn't gotten out of the cave and they hadn't gone downstream, so we kind of picked a spot in between some of these large boulders of ice, anywhere from 4 to 7 feet thick ice.
I felt much safer for the boys when the rescuers did get up there. They talked me into taking the girls back down the mountain. That's one of the hardest decisions I had to make, was to not be up there.
Little by little, we worked our way down to the point where somebody could get down to the riverbed and actually shout down and see if we had any response or if we could identify anybody underneath the ice. Sure enough, he heard a voice. So at that point, it turned from a recovery to a definite rescue.
And then, of course, they hear the voice, and it's like, I still feel that little tingly. They hear the voice, And then they hear the second voice, and it's like, oh my gosh, thank you.
It was amazing to hear that they were alive. You know, I was shocked and so relieved.
A couple minutes after we both heard the thuds, they fired up the chainsaw so we could both hear the chainsaw, and we knew that they were up on the ice trying to get us out. So that's when I started yelling. Once they made voice contact with us, I felt really relieved.
We all realized that getting to Harborview, the level 1 trauma center in the area, that it's going to be the quickest. It's got the helicopter pad. It's got access to all the resources you need, and that's where all trauma patients go. So it was really no question that once it was decided that these patients who were going to be flown out, that they were going straight to Harborview for care.
Once we heard that they were on the helicopter and that the helicopter was leaving, we were all so happy and eager to get to Harborview. And when we got there, I let them know that I was the mom of one of the boys in the ice caves. And, everyone was so nice and so accommodating.
We are the only adult and pediatric level 1 trauma center in Washington, Alaska, Montana, and Idaho. And so we see the worst of the worst when we're taking care of kids with burn or traumatic injuries, and they all come here to Harborview.
One of the first things I remember getting to Harborview is I could see Alessandro right away. And the fact that I could go back there where he was being treated and be there with him and just chatting with the nurses and being there and I couldn't touch him because I'm afraid if I just put one little finger, I'd hurt him, because obviously at that point I saw, what a bad shape he was in. And then just seeing just people after people coming in, knew exactly what they needed to do. And I would just stand back and sort of be in awe.
When we found out he had a broken back, actually I don't remember at what point, because we were up all night with him, I didn't feel worried. I knew he was in good hands.
Both Alec and Ollie both had similar injuries in their lumbar spine. They had broken backs. I had a chance to talk to their families immediately after the surgery, who obviously for legitimate reasons were very concerned. We reviewed their x-rays from before their surgery. I tried to explain to them what their injuries were, showed them what we'd done at the time of surgery, tried to explain why we did what we did. And I think that's important to kind of give them a peace of mind and give families a jump start as far as what we're doing, why we do what we do, as opposed to got a broken back and it was fixed, but don't really know the nature of it.
I thought they did a fabulous job at keeping my husband and I very calm about the information, but yet at the same time giving us the information and not hiding it from us. So it was a great balance of being assured that whatever needed to be done was going to be done, and that they just expected full recovery.
In the boys' situation, they've often talked about how they were awake during their rescue and what a very scary time that was. And that's those are very difficult memories to have to deal with even long after the physical trauma has healed.
I think it's just one of the things that makes Harborview so good and makes Harborview what it is that we have specialists in every field. And so we can focus on these, and there are studies that show that provides the best outcome for patients if they have a group of specialists who can focus on their particular area without having to reach outside their particular niche. It was great to see Alec and Ollie today. It's been at least 6 months or so since I've seen either one of them. They certainly have grown and matured and off to university and everything and back in their sports. But it's great to see them and that they're moving on from this and recovering well. Every time they come back, they look more like humans and less like patients wrapped in plaster or bandages. It's always great to see them, though. So I think, in Alec and Ollie's particular situation, they were brought here, they were polytraumatized. That's what a level 1 trauma center is for, is to deal with those type of issues. And as part of the University of Washington system, we have easy access to children's, we have easy access to the university, we have easy access to Harborview because we all play together as a team.
At first, I didn't even know that Harborview existed, but after this whole experience, I'm just so thankful that Harborview's there and the nurses so dedicated, and doctors are so dedicated there and so supportive for me.
You just felt so well taken care of, and I just remember just the incredible amount of energy, focus, dedication by all those nurses and doctors.
Whenever I go back to Harborview, I get pretty excited, and I actually enjoy going to the hospital now just because I had such a good experience. If I could say something to the doctors and nurses at Harborview, it'd be thanks. And the entire time I was there, I didn't have any worries at all. You know, I knew that they knew what they were doing.
At their ages of 14, 17, they're going to be okay.
To think that somebody was trapped for 5 hours, and today they're back playing soccer, off at college, going on with their lives.
And it's amazing what I saw. I would never go to any other hospital other than Harborview. I would never have my kids go to any other hospital. It was amazing to me. I never knew that Harborview was what they are. A great, amazing hospital.